Non-steroidal anti-inflammatory drugs, also known as Nsaids, are medications that are used for mild to moderate pain, fever, and inflammation. They are some of the most commonly used medications in adults on a daily basis. Nsaids can fight those everyday pains such as headaches, body aches, strains and sprains, arthritis and back pain, and menstrual cramps, among others. Nsaids have three principal therapeutic effects: to work as a non-opioid analgesic in order to reduce pain, to work as an antipyretic to reduce fever, and to work as an anti-inflammatory to reduce inflammation and swelling. In order to understand Nsaids, we must comprehend their mechanism of action. Let's watch the following video to see how they work.
Damage to cells and tissues, for whatever reason, results in nociceptive pain, inflammation and possibly fever due to the release of chemical mediators known as prostaglandins by the affected tissues. These prostaglandins are produced by two forms of cyclooxygenase enzymes, known as COX-1 and COX-2, from precursor molecules known as arachidonic acid. The prostaglandins produced by COX-1 are generally responsible for the maintenance and protection of the gastrointestinal tract, kidneys and other organs, while those produced from COX-2 are predominantly related to inflammation and pain responses. The prostaglandins that are released stimulate nearby nerve endings, resulting in pain signals being transmitted to the brain via the spine. Nsaids mainly work by competitively inhibiting the production of prostaglandins from the COX enzymes. In the case of ibuprofen, this occurs by the drug competing for the substrate binding sites on both enzymes. This occurs both at the site of the pain and in the central nervous system. As the production of prostaglandins diminishes, the intensity of the pain signals being sent to the brain diminishes. Therefore, Nsaids such as ibuprofen target the source of pain by lowering levels of prostaglandins predominantly at local sites, with some activity also in the central nervous system. Like other Nsaids, aspirin mainly works by inhibiting the production of prostaglandins from the COX enzymes. However, aspirin does this by irreversibly modifying the COX enzymes, rather than just competitively blocking their action. As the production of prostaglandins diminishes, the intensity of the pain signals being sent to the brain diminishes. As the COX enzymes have been irreversibly modified by the aspirin molecules and can no longer function, the cells of the body need to make new copies of the enzymes, which may take a few hours. However, platelets do not produce new proteins, so their clotting function is impaired until completely new platelets are formed and replace the altered ones, which can take many days. Thus, while aspirin has a short-lasting analgesic effect, its effect on blood clotting can be relatively long-lasting.
Nsaids can be classified based on their chemical structure. The most common classes are salicylates, propionic acid, aryl acetic acid, oxycams, phenamic acids, alkanones, and COX-2 inhibitors. Each contains a variety of generic name drugs as well as brand name drugs. They can also be identified as selective or non-selective Nsaids. All Nsaids have approximately the same efficacy, although the adverse effect profiles vary among the different drugs. Most people tolerate Nsaids without any difficulty. However, some side effects can occur. The frequency of side effects varies among Nsaids. Common side effects are nausea, heartburn, upset stomach, diarrhea, vomiting, constipation, decreased appetite, rash, dizziness, headache, drowsiness, and ringing in the ears. Medical conditions can be worsened or increased when taking Nsaids. Important adverse effects must be considered if a person has at least one of the following: hypertension, cardiovascular disease, ulcer disease, bleeding from the stomach, upper intestine, or esophagus, interaction with other medications, fluid retention, kidney disease, aspirin allergies, before surgery, and pregnancy. Nsaids are available as a prescription from your healthcare provider, and some are available to buy over the counter, which means you don't need a prescription to take them. They are prescribed in different doses depending on your condition. Dosages may range from 1 to 4 times per day depending on how long each drug stays in the body. No single Nsaid is guaranteed to work. Your doctor may prescribe several types of Nsaids before finding one that works best for you. These drugs can be taken orally in forms of tablets or capsules and is the most widely used method. Some NSAIDs are available as injections. This form is used for pain after surgical operations and is also very effective for the treatment of pain produced by kidney stones. They are also offered as suppositories and are often used for postoperative pain and sometimes in chronic pain when the patient is unable to take medication by mouth. Creams, gels, and foams to apply to the skin are another form of administration. These are not felt to be as effective, but some people do get considerable relief from their use.